In this video, I'm going to show you 4 exercises that can help if you find yourself frequently getting up to use the bathroom at night, or if you experience pain in your groin, pelvic floor, or tailbone area. When it comes to exercises for men, Kegels are almost always the first thing people recommend. But the hard truth is that for many men over 60, traditional Kegels can actually do more harm than good. Instead of the classic Kegel, you should be doing the reverse Kegel, a completely opposite movement. So without further ado, let's jump right into the first exercise. Exercise number 1, forward and back. Leans on the toilet for complete bladder emptying. How to prepare. Sit comfortably on the toilet with your buttocks fully on the seat and your feet planted firmly on the floor. Your back should be straight but relaxed, not stiff. You can rest your hands on your thighs or knees for extra stability. The technique. Start urinating as you normally would, allowing your pelvic floor muscles to relax. When the main stream starts to slow down, lean forward slightly, bringing your chest toward your thighs. You should feel a gentle pressure in your lower abdomen. This helps to push out the remaining urine. Hold this forward lean for a few seconds while continuing to breathe steadily. Return to an upright sitting position. Relax your torso and let any remaining drops come out naturally. Next, lean back slightly, as if to gently puff out your chest, but avoid arching your back excessively. This position allows the pelvic floor muscles to open up one more time, releasing any last traces of urine. Hold this backward lean for a few seconds, maintaining a calm inhale. Return to your initial seated position and wait for the last few drops to pass. Repeat the lean forward, return, lean back, return cycle 4 to 5 times, or until you feel that your bladder is completely empty. To finish, after the final cycle, wait a couple of seconds to make sure everything has stopped. Stand up slowly, making sure you feel balanced. Helpful tips. All your movements should be smooth and gentle, without any jerking. When you lean forward, imagine you're trying to look at your knees. When you lean back, think about opening up your chest. Try to sync your breathing with the movements. Exhale as you lean forward and inhale as you lean back. Make this a daily habit, especially in the morning and right before bed, to ensure your bladder is fully emptied each time. Exercise number 2, happy baby pose. This next one is a highly effective exercise for relaxing the pelvic floor muscles, and it's called the happy baby pose. It's perfect for men over 60 because it gently stretches and releases the muscles in the pelvic region, improves blood flow, and helps relieve built-up tension. Alright, let's get started. Find a quiet space and lay down a soft mat or a blanket on the floor. Lie on your back, stretch out your legs, and allow your body to fully relax. Begin by taking a few deep breaths in and out to settle into the exercise. Next, bend your knees and draw them in towards your chest. If it's difficult to grab your feet, just hold onto your shins right below your knees, whatever feels more comfortable. Now, gently guide your knees apart, imagining your hips are opening up as your knees move toward your armpits. Your feet should be facing the ceiling and your back should remain pressed firmly against the floor. Now bring your focus to your breath. As you inhale, feel your belly and lower pelvis expand with air. On your exhale, visualize your pelvic floor muscles gently dropping and releasing. After 3 or 4 deep breaths, you can add a little movement. On an inhale, gently widen your knees, and on an exhale, softly bring them back toward each other. This gentle, wave-like motion helps you connect with and release deep-seated tension. Hold this pose for 1 to 2 minutes to start, and gradually work your way up to 5 minutes. If you feel any slight discomfort in your knees, slide a rolled-up blanket or a small pillow under them for support. To prevent any strain on your back, you can also place a thin cushion under your lower back. When you're ready to finish, bring your knees together, gently roll onto your side, and carefully push yourself up to a seated position. After this exercise, you'll definitely feel a sense of lightness and relaxation in your pelvic area. Try to do the happy baby pose a few times a week, especially after long periods of sitting or on stressful days. I'm confident it will become a trusted tool for supporting your pelvic health and overall well-being. Have you heard of this exercise before? If so, please share in the comments if it has helped you. Your experience could be incredibly valuable to others, so don't hesitate to share. Exercise 3, the Reverse Kegel for men over 60. Now we move on to the third and most important exercise in this routine, the Reverse Kegel. This movement is designed to gently stretch and relax the pelvic floor muscles, improve circulation in the pelvic region, and relieve the feeling of congestion that often affects men over 60. What you'll need: a non-slip mat or any flat, comfortable surface like a couch, bed, or a blanket on the floor. A thick pillow for your head and shoulders to ensure your neck stays relaxed. 2 supports for your feet, such as yoga blocks, rolled up towels, or small cushions. Step-by-step instructions. Starting position. Lie on your back. Place the pillow under your head and shoulders to make it easier to reach your perineum. Bend your knees, bring the soles of your feet together, and let your knees fall out to the sides in a butterfly position. Rest your feet on the blocks or cushions. This will take the strain off your inner thighs and allow for maximum relaxation. Hand placement. Right hand. Place your palm flat on your lower abdomen, just below your belly button but above your pubic bone. Left hand. Place your fingertips on the perineal body, the area between the scrotum and the anus. Your hands should be firm enough against the skin to clearly feel the muscles move as you breathe. Check for sensation. Give a short, firm cough. You should feel your pelvic floor muscles push or kick against your fingertips. If you don't feel it, try coughing a bit more forcefully to make sure your hand is in the right spot. The breathing technique. Inhale. Take a slow, deep breath, focusing on sending the air down into your lower abdomen and perineum. Your chest should move very little, and your lower back should stay connected to the floor. Exhale. Let the breath out calmly and smoothly, without forcing it or holding it at the end. As you inhale, you should feel a gentle pressure from your belly and perineum pushing into your hands. As you exhale, you should feel the muscles relax and soften. Duration and rhythm. Continue this cycle of deep inhales and calm exhales for 2 to 3 minutes. The deeper your inhale, the more effective the stretch on your pelvic floor muscles will be. Finishing the exercise. After your final exhale, gently bring your knees together, remove your hands, roll over to your side, and slowly push yourself up. Take a moment to allow your body to rest and notice the feeling of relaxation. Tips for men over 60. If your hips are tight and your knees don't open very wide, try holding onto your shins instead of your feet. Place soft pillows or bolsters under your knees if you feel any discomfort. Breathe evenly and never push into pain. The goal is a gentle stretch, not a strain. By adding the Reverse Kegel to your daily routine, you'll start to notice a greater sense of ease in your pelvic area, less tension, and a reduction in that feeling of congestion. Are you familiar with this exercise? Please share your experience in the comments. It could be a great help to other men. Exercise 4. Belly breathing while lying down. This exercise is incredibly important because it helps relax muscles that are tight or in spasm, and it's also a great tool for reducing anxiety. If you often wake up in the middle of the night and find it hard to fall back asleep because of racing thoughts, this exercise will be a game changer for you. Breathing technique. Lie down and slightly bend your knees. Place one hand on your belly just below your rib cage and the other hand on your chest. Relax. Breathe in deeply through your nose, feeling your belly expand, and push your hand upward. Exhale slowly through pursed lips, as if you were gently blowing out a candle. Repeat this 8 to 10 times. For an even deeper state of calm, you can use a special technique called box breathing. Just like before, lie on your back with your left hand on your belly and your right hand on your navel. Remember, we're focusing on breathing only with the belly. Your chest should remain almost still. The box breathing technique. Inhale slowly as you silently count to 4. 1, 2, 3, 4. Hold your breath at the top of the inhale for a count of 4. 1, 2, 3, 4. Exhale slowly and completely for a count of 4. 1, 2, 3, 4. Hold your breath at the bottom of the exhale for a count of 4. 1, 2, 3, 4. The key is that the inhale, hold, exhale, and second hold are all equal in length, creating a box shape with your breath. A comfortable rhythm for most people is about 4 to 5 seconds for each part. To make this exercise even more relaxing, you can play some soft, calming music or nature sounds in the background. I recommend doing this exercise last, right before you plan to go to sleep. It's so relaxing that you might even drift off to sleep while doing it. And that's perfectly fine. It means it's working. And there you have it. 4 simple yet powerful exercises to help you take control of your pelvic health, reduce those nighttime bathroom trips, and find some real relief. I recommend performing these exercises in the exact sequence shown in this video. First, go to the toilet and empty your bladder as completely as possible. Then do the happy baby pose exercise, which will relax your pelvic floor and warm up your leg muscles. Next, perform the main exercise, the reverse Kegel, and finally, follow it with the breathing exercise. Remember, consistency is what matters most. Try to incorporate these gentle movements into your daily routine, and you'll be well on your way to feeling more comfortable and in control. Also, a quick reminder, always consult with your doctor about any contraindications before performing these exercises, so they only benefit you. Thanks for watching. If you found this video helpful, please give it a thumbs up and be sure to subscribe to our channel for more tips on staying healthy and active. Thousands of seniors have found this video helpful, so I highly recommend you watch it. Click to keep going.